So are you feeling stuck with your well-being, maybe feeling low on energy? Or have you been trying to shed some weight, but without success over the past few months or even years? Or perhaps you're a sports enthusiast who's plateauing on their fitness levels and you just don't know how to break through. If any of these questions resonates with you, then this episode is for you. In today's episode of The Wellness Shift, we welcome Dr. Vik Vasishta, who will talk to us about how to live better, improve your fitness levels, and ensure you're living a healthy life right to the end when it's time to check out. I'm Bruno de Jong, physiotherapist and founder of CBA Clinics, a physiotherapy and wellness business located at Waterloo, Elephant and Castle, and Canary Wharf areas in London, where we help people take control of their health through expert care, movement, and mindset. So Vic, welcome to the Wellness Shift podcast. So tell our listeners who you are and what you work with and anything else you think might be relevant to your intro.
Cool. Thanks so much for having me, Bruno. It's a real pleasure to appear on this podcast. A little bit about myself. I am a GP working in the NHS and the private sector. Within the NHS, I'm a salaried GP in West London, and my private practice is based in Canary Wharf at an organisation called Leica Health. Really enjoy the differences between the two different specialties. Really, they're focusing on different things, and it's very interesting to work across both fields. A bit about me: I'm a really passionate endurance athlete. My main hobby outside of work. I've completed a couple of Ironmans, and I'm very interested in kind of everything running, cycling, and endurance. I really try and bring that aspect of things to my patient care, try and make it as holistic as possible, and have a view towards trying to rehab people, because I'm injured. I'm injured every other week myself, so try and share some of those experiences. So I cycled to Paris over 2 days, which was super fun. Solo trip, did it by myself. Bike packing, and it was just unbelievable experience. So many interesting memories along the way.
That's great. That's great. What do you see in clinic, and how do you tackle those challenges that people come with?
So it's a really interesting question. I think really on point, really to where we currently are with healthcare. To answer your question, that there's a new brand of medicine which has come out in the recent past called lifestyle medicine, regenerative medicine, and it's very much focusing on the prevention of chronic diseases, the prevention of diseases that people acquire in their 30s, 40s, and 50s that actually go on to have a massive impact on when somebody actually dies. Because you may die in your 70s, 80s, or even 90s, but the disease processes which enable that to happen start at a much earlier stage. So with that shift in kind of disease prevention and management focus, I'm seeing that a lot with the patients that come in, and they're very much thinking about, what can I do now in my 20s, 30s, and 40s to prevent that happening? And as a clinician, that's a great patient to have, because we can use those skills, those regenerative medicine skills, apply it directly to them, and offer them ways to address those chronic diseases before they have a chance to affect the aging and eventually dying process. So that's something I'm really interested in.
And I find that usually it's the 20s, maybe the 30-year-olds who they're not historically, they're not as invested in their health as people in the 40s, 50s, or 60s.
Yeah.
Right. So do you find that there's been, is that shifting a bit?
I think so, for sure. I think people are a lot more conscious about their health and well-being, really, and they have an eye to the future. So that might just be things like be more active, more physical. It could be sleep trackers. The new generation of smartwatches have got fitness trackers, sleep trackers. Of course, there's Whoop, which I'm a big fan of, to actually understand more about your metrics. You know, they are, there are a lot of changes in that kind of technology, health infrastructure interface, where I'm seeing that younger people coming in.
How do you go about trying to coach them into realize, look, now is the time to do a bit of legwork, create some good habits? So how do you go about talking to people like that?
Well, especially the private sector, a lot of the time they've already done their homework. They're coming in and they're saying, I am concerned, for example, about my risk of developing heart disease. I have a family history, a strong family history of my parents having heart disease, high blood pressure. I don't want that to happen to me. What steps can I take? And that's really the ideal patient, because they're switched on, they understand their own risks, and they want to come to you to seek your expertise on how to modify those risks. And that's a really kind of enjoyable consultation to have. The challenges, I would say, come more on the NHS side of things. When you have limited resources, limited time to spend with someone, and maybe not quite as much resource to offer, that's where the challenge comes in. Because arguably, when you're looking at disease prevention, a lot of the time in the NHS, the patients you see may be coming from a more of a socially deprived background in some instances. They arguably need it more, but the allocation of resources isn't equal and even. So sometimes that can be a challenge.
So what are the resources we're talking about?
Access to blood tests would be the first port of call, and doing slightly more advanced blood tests than just your basic cholesterol panel. Then that would move on to potentially doing scans. So if you, for example, are worried about your risk of having a heart issue, you could have a CT calcium score done, which actually risk stratifies what your chances of having a coronary event, an event with your heart, are. It puts you into a low risk, medium risk, and a high risk category. And people in a higher risk category may go on to have a CT angiogram, where they actually have a look at your heart vessels and see what degree of obstruction you have in those important blood vessels in the heart. So access to those tests is definitely more readily available in the private sector. And then also the expertise of a cardiologist. You know, if you're thinking about heart health, I've got a cardiologist in my private practice just down the corridor. I can go and speak to them anytime. Trying to access that in the NHS is very difficult because of services oversubscribed.
Yeah. If you could try and reach out to someone who wants to create change in their lives, but is a little bit stuck. Maybe they're overweight. They don't know. They've tried this X, Y, and Z, but they're still a little bit, I just don't know how to get things done. What sort of tools and resources or even tips can you give them today if they're listening to this that could change things?
The first thing I would say is it's never too late to affect change. Whether you're somebody who's actually had a heart event, somebody who's worried about having one, there's no downside to seeking medical help and starting on that journey. So that's the first thing I would say. Second thing is very important to understand what your risk is. And that would involve coming in to see a doctor, having some basic blood tests done, including things like your cholesterol levels, your triglyceride levels, and your diabetic screen. So understanding what your HbA1c is, height, weight, blood pressure. So get the overall package of how at risk am I of having an adverse event. When you understand that, then you can give some more tailored tips to the individual. So for example, I had someone came in to see me who had very high cholesterol levels. They were not particularly overweight, but they had some stubborn belly fat that they just could not shift. And when I went more into the kind of nuts and bolts of their setup, it turned out they were doing a lot of exercise, but it was all very high intensity exercise, HIIT classes. They were going out, they were doing kind of sessions with a PT, really getting a sweat on, half an hour, and coming out feeling very energized, but they could not shift the weight. And what I said to that individual is, don't neglect zone 2 training. Now, the first thing they said back to me is, what is zone 2 training? And I said, well, it's a bit of a buzzword in the endurance world at the moment. You may have heard slogans like, you need to run slower to run faster, that kind of thing, and everyone's been talking about zone 2. Are you familiar with zone 2, Bruno?
Yeah, I think I think in the past I have come across that. I had a friend in university, and he was doing physical education degree, and he would told me about this was like 20 years ago. So talk to us about that. Explain to our listeners, what is
So,
that?
so you essentially have 5 heart rate zones. Zone 2 is specific to heart rate. Essentially, I brought my little statistic chart up here so I make sure I give the right numbers. Zone 1 is working to around 50 to 60% of your maximum heart rate, so the maximum you can do. Zone 2, 60 to 70%. Zone 3, 70 to 80%. Zone 4, 80 to 90%. And zone 5, 90 to 100%. Now, within those different numbers, those different zones, the fuel source that you will use to sustain that exercise differs. So in zones 1 and 2, you're going to be using, and mainly zone 2, fat as your primary resource. So if you're someone who's got a high cholesterol, as was in the case of this patient, stubborn belly fat, you can't shift. Doing high intensity exercise may not necessarily be all of the answer. Doing sustained zone 2, where you're using fat as your primary resource to sustain that exercise, is what will help you to shift the weight. In zone 3, you'll be using a mix of fat and carbohydrates, so still very important. And zones 4 and 5 are exclusively carbohydrates. So you are using what you have access to, but you are not tapping into those fat resources. So it's not uncommon, for example, go out, do a really high intensity exercise, you feel really energized, really pumped, and then you're hungry, so because you've depleted your carbohydrate reserves, so you eat something carb rich, and you feel great, and you go on and you keep doing that, and you get fitter, but you don't get any slimmer, and that's why you need that zone 2 training, of which there are many other benefits in addition to just fat burning.
So what you're saying is you could be working as hard as you want to lose weight. You could be working out every day, absolutely giving your all, and you're not going to shift that fat tissue because you're not working on zone 2. Is that what you're saying?
You'll struggle to shift it. And that doesn't mean that there's not a place for zones 4 and 5, because there definitely is. That's going to make you fitter. Those what we call VO2 max sessions are really important for you actually getting fitter. And they should be involved. But you're looking at maybe a 70-30 or an 80-20 split in favor of zone 2 versus zones 4 and 5.
Wow.
In order to give yourself the best chance of shifting that stubborn weight. And that actually worked for this patient. So they came back 8 months later, I'd kind of forgotten, and they said, wow, Dr. Vik, thank you for that advice. I've actually lost 10 kilograms of weight I didn't even know I could lose.
Wow.
My belly fat has shifted. And when we did their lipid profile, the numbers had actually improved. And what was really, really interesting is he shared something which is very kind of special, and I think, in this context, because it's something I've experienced as well. His running performance improved. He got faster, which is where this run slower to get faster thing comes from. And he was raving about it, and it was lovely to hear. It was great.
That's brilliant. That is amazing. So if someone who's listening now says, okay, I'm going to try and do this, what tools can they use, or how do they know they're on zone 2? Or is there something that you have to use?
So I would say there is a homemade approach to doing this, and then there's the bells and whistles. So there's the two ways you could approach this. Either way, whatever option you do, you need a modality to record your heart rate whilst you're exercising. So be that smartwatch that's measuring at the wrist, or if you want to go fancier, a chest strap. But there needs to be some measurement of heart rate. I would say the current impedance measurements in the gym you get on the machines aren't too accurate, so I would probably use those as a last resort. So you've got your two options. Your homemade approach would be put on your heart rate monitor, find a big hill or a nice flat surface, and run to the point where you feel that you are going to collapse. You are working as hard as you possibly can. You cannot sustain it anymore. I say to the point of, because we don't want people, overexerting and having any adverse effects. And then measure what that heart rate was, that peak heart rate was. That is likely to be your sub-maximal heart rate, your sub-max. You could probably have gone slightly higher, but that really is the highest that you can safely go to.
So would that be zone 4 then?
That would probably be the midpoint of zone 5. You then go to your smart watches app. So, we're not affiliated with them, but Garmin, Whoop, Wahoo, whatever you're using, or Apple Health, and it will ask you to set up your cardiac zones. And it will want to know two things. It will want to know what is your maximum that you can sustain and what is your resting. Put those two pieces of information in, and it will calculate for you zones 1 to 5. And then it's very simple. When you're out for a run, cycle, whatever it is that you're doing, and you want to do zone 2 training, you just keep your watch on and aim for that to stay in that heart rate. And that will allow you to sustain. So that's the homemade approach.
And the resting one is obviously when they are sitting down, just not doing anything,
Yeah, so you
or
want to
just walking.
put the smartwatch on for maybe a couple of days, and it will tell you what your resting heart rate is. It
Okay.
will take into account a series of data, and it will tell you your resting heart rate is X.
Gotcha. And the bells and whistles.
Bells and whistles would be going to have a VO2 max test done. So you go to a lab, specialized lab, they put a mask on you, and you basically exercise you safely to the point you're going to collapse. And they're measuring your expired gases that's coming out, and they can work out from that when you switch from fat metabolism to carbohydrate metabolism, and they can work out what your VO2 max is, which is the maximum volume of oxygen that you can uptake during that point of exercise. And it's measured as per your body weight. And that will give you a very detailed breakdown of exactly what your heart rate is.
Right. Is that available in Leica Health?
Sadly, not at Leica Health, but it is available at other places. And it's something I actually went and did. And I say if you're serious about endurance, having a VO2 max test really informs your training. My zone 2 was actually considerably lower than I'd always thought it was. And it meant when I go out to do zone 2 runs, I'm running considerably slower that I should have been running. And that in turn has made me fitter and faster.
Yeah. And then what's the, because I don't know this as well. So what's the, if I'm going to go for a zone 2 cardio session to try and strip the fat, how long should I do it for? What's the optimum time I should aim for?
The optimal time is as much as you can do. So if that's half an hour, it's better than nothing. In an ideal world, zone 2 is going to be your longer sessions. So if you can spare an hour, that's great. And I guess also it depends upon what is your training tool. If you're cycling, zone 2 cycling is best to do it for longer. If you're running, it could be a shorter period of time. But I guess the moral of the story is anything's better than nothing. Some time in zone 2 is better than no time.
Right. Brilliant. Right. So what, for someone who's listening now and then thinking, God, I really need to do something and I'm just feeling a little bit stuck, what would you say to someone who's just sort of on the fence about making a choice to coming and having a chat or whatever it is?
It's that old adage you hear a lot: knowledge is power, and power is knowledge. So putting yourself in a position to receive information about yourself will only help to inform the decisions that you make. And it's very easy to be feeling stuck or not wanting to engage because you don't want to know necessarily what the answers are. And I would say in either of those situations, it's best to reach out, have a discussion with a health professional, have some tests done, and understand where you are. Because the decisions you make in your 30s and 40s will really influence the life that you have in your 60s, 70s, and 80s. There's the kind of the father of regenerative lifestyle medicine's a famous doctor working in the US, and he talks a lot about, and I'm a big fan of him, I read his book, he talks a lot about medicine 2.0 and medicine 3.0. And the difference between the two is, if you're looking at a graph, is do you kind of have a steady decline all the way from your 50s, 60s, 70s, where your golden years, you're unable to walk, you might be short of breath, you're suffering with chronic diseases, and you may live to 85, 90, but the last 30 years were miserable? Or do you go for the medicine 3.0 approaches, which you're staying in good health, kind of up to 85, 80, then you have a sharp decline, a sharp death? I think the evidence is pointing more towards the second option being better, because you can enjoy more of your later years, but the decisions that you make now will heavily influence that end out.
Yeah. Brilliant. Vik, thank you so much for taking the time to come and meet us and talk about your experiences. It's I hope that everyone who's listening has felt inspired to go and take some action now. So thanks again for your time, and we'll see you on Leica.
Yeah, no, thank you so much for having me. It's been an absolute pleasure. And if anyone ever has any questions or concerns, please reach out to me. I'm always happy to speak to anyone.
Great. Thanks, Vic. We'll see you soon. Take care,
Bye,
everyone.
bye.
Bye.